Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Weening.
And I'm Dr. Paul Zalzal.
On today's episode, we're answering a question that comes in the office quite a bit and has been on the YouTube channel and our comment section. Am I too big to have a hip or knee replacement?
Too tall?
So too tall, I guess, could be, because theoretically the physical size of the implant might be exceeded. But no, I think most people are saying, do I weigh too much to be a candidate for this procedure?
Okay, good question.
What do you tell them?
Well, I tell people that if you have an increased size, and we usually measure that with a body mass index, it's called BMI.
How do we calculate BMI?
We calculate BMI by taking your weight and dividing it by your height squared.
Right, and that's for our American audience or imperial people, that is your weight in kilograms divided by your height in meters.
That is...
Not pounds and inches, otherwise I'll give you the wrong number.
Yeah, that is the metric way to do it, right?
Yes.
Although there's calculators online, you can go and put in pounds and inches. Just go online, body mass calculator, and you can figure out your body mass. So BMI.
Okay, now do you have a number, Paul, that you say, here's the number where I'm happy, you're not happy?
I don't have a specific number. I know our anesthetists get nervous when it's 50 or over, and there was some talk about some of the anesthetists saying, well, we don't want to give an anesthetic if it's 50 or over,
right.
But 50 is very high. Anywhere over 30, you're starting to get into a little bit of challenges with surgery and things like that. So I tell my patients, like, if you have an elevated BMI, the risk of something going wrong during surgery is increased.
Yes. Okay, so number one reason why you may or may not be a candidate is because of a higher risk. So are there specific things that you worry about?
I worry about infection.
Me too.
If you have a lot of extra soft tissue around your knee or your hip or whatever replacing, then the risk of infection, I think, goes higher. Now, the studies in the literature are split on this.
Yep.
Some studies say, risks are way higher. Others say, risks are a little higher, but it's an acceptable amount of risk.
Yep.
So the studies sort of go back and forth. So just going from personal experience, I find that if you have an elevated BMI, your risk of infection, whether it's soft tissue or pneumonia or something like that, do go up.
Agreed. I would say the other thing that's certainly reasonably well documented is that there's a slightly higher risk of any type of anesthetic complication, whether that's to your heart or your lungs or whatever. That's, I think, a well-known fact.
Okay.
Okay, so that's number one, higher risk of a complication. My number two would be that it's hard to do. It makes the operation actually physically more challenging, and often gaining access to the joint to do the procedure itself becomes more difficult.
Yeah, no study is going to prove that, but just from experience, it is more difficult to do.
It takes longer to do. I think that's not negotiable.
Yeah, the surgery takes longer and it's more challenging to do the surgery.
Okay, so that's number two. What's number three?
Well, it's a little bit more of a long-term consequence, but
Yes.
I think the artificial joints can wear out or loosen quicker if you do have if you're carrying more weight, because that's more load on the implant. So
Particularly knees, right?
Yeah. Particularly, it may not last as long.
Right. So that's reason number three. Do you have a number four?
No, those are probably my top three reasons.
I'd say my number four is that I think recovery is harder. If you're carrying extra weight, you have to work really, really hard. And even if you're not carrying extra weight, it's already hard. So you're just making it a little harder on yourself than potentially it has to be.
And now I have a 4.
Okay, no, now you got 5 because I just did 4.
Oh, I don't have 5.
Oh, okay. Oh, you got my 4.
Yeah, I took your board, your 4.
So increased risk of complication, increased risk of early failure, harder for the surgeon, harder for the patient. Now, do studies show that people that carry extra weight are less happy?
No way. Very happy. The satisfaction rate, if you exclude all of the complications, the satisfaction rate is still very high with artificial joints.
And I think sometimes I would argue maybe they're even more happy because I see a lot of people who have been told that they have been too heavy for a procedure by another surgeon potentially, and then the fact that you agree to do it makes them happy, and then they're like, I'm going to prove that other guy or gal wrong, and I'm going to really, really work hard to try to get through this and be happy.
And of course, after you replace someone's joint, if they had an elevated BMI, they always lose weight, right?
So no, actually, that's very interesting because a lot of people say to me, I carry a lot of extra weight, I just need to get my knees replaced, and then that's going to be the thing that allows me to lose weight. So generally speaking, studies have been shown that actually a lot of people do not lose weight after joint replacement because a lot of extra weight is a multifactorial problem, but I think the joint replacement solves a very small part of the problem.
Yeah, I have had a number of patients where I've encouraged them to lose weight before the surgery, and they've done so. And sometimes the pain goes away, and we can delay surgery.
Right.
And the other problem is often the population of patients who have an elevated BMI that request a hip or knee replacement are younger.
Yes.
Because they wore out their joints earlier because of their elevated BMI.
Yep.
So that's a double-edged sword because we don't like replacing joints in young people because they can wear out faster.
It's like
It's a vicious circle.
Vicious circle. So what I tell my patients, I'm sure you tell them the same, is do your best. Try to lose as much weight as you can before surgery within a reasonable amount of time. I think obviously if you're in agony and you can't do anything and your weight's going up, then sometimes you have to do the joint replacement maybe to stop the weight gain. So be realistic, have a frank conversation with your surgeon and with your patient, try to figure out what you guys can agree upon and maybe even set a goal. Sometimes I'll say, listen, I'm gonna bring you back in 3 months, let's see if we can lose like a pound a week or something and try to get a little bit of momentum heading into surgery. Because if you can at least be stronger and motivated to keep it going, sometimes that allows them more success.
Good advice.
So if you like this video, please like it and leave a comment on our channel.
And remember, you are in charge of your own health and your own body mass index.
We'll see you next time.